as Naomi said, my name's Tara Chalmers-Nixon. This is very high. I am a gastroenterologist in the East Kootenays. I live in Fernie, BC, but I really am based out of, most of my patients come from all over the East Kootenays. And my project with many partners, as you've heard from already, was improving the access to specialist care for those with liver disease. So what is the background? Well, Canada is actually behind many other industrialized countries in screening and treating for hepatitis C, in part because we don't have a nationalized program to address this issue. In general, chronic liver disease is on the rise everywhere in the world, Canada as well, mostly as a result of non-alcohol fatty liver disease associated with obesity. Thirdly, our First Nations populations are overrepresented with those with liver disease. They are 7 times, this is Canadian data, they are 7 times more likely to suffer from hepatitis C, alcohol-related liver disease, and non-alcohol-related liver disease. And this is data out of Saskatchewan, comparing them to the general population. And if you're diagnosed with cirrhosis and you have symptoms already, usually those are life-threatening events, that is encephalopathy or confusion. You've got a variceal hemorrhage and you come in bleeding to death to the emergency room. You have profound ascites or fluid collecting in your abdominal cavity. You have renal failure, or you have primary liver cancer called hepatocellular. And if you present with one of those decompensating events, your median survival is only 2 years versus 10 years if you present earlier. So the problems, I tried to narrow it down and had lots of help doing this. So the 2 problems I said a problem is it takes 9 months to get in to see me, and if you're only going to survive for 2 years, waiting a year to see me is not acceptable. And number 2, hepatitis C is underdiagnosed and undertreated in our area, and so I'm going to do my bit. So I was hoping to try and reduce the wait time to see the liver specialist care to less than 6 months' time, and I've adjusted the time frame. So first it was going to be July 2019, and now we'll just say July 2020. I'd like to screen 75% of those in my local First Nations community at Tobacco Plains Reserve for hepatitis C. Those would be considered at risk just based on birth cohort or other risk factors. And so far I have 6 people tested out of, I think, 200, but we're getting there. And then thirdly, screening 75% of those with cirrhosis who I've actually seen for hepatocellular carcinoma. These people are supposed to get an ultrasound every 6 months. So what PDSA Cycles have I worked on thus far? Well, I developed, in conjunction with my patient partner, a survey at the beginning to make sure that they understood the process, and this has been implemented in some clinics. I created a referral checklist for primary care providers, and that's been implemented so that the patients have their workup complete prior to seeing me in consultation. And then I have a checklist for my MOA or an RN to make sure that that's done before I see the patient in consult. We have a standing order now, so the radiology department at our local regional hospital in Cranbrook, the East Kootenay Regional Hospital, they're very accepting of this standing order, which I just fax in, and they look after booking a patient every 6 months for their screening ultrasound. I've given 5 talks, which doesn't hold a candle to Jeff Harries, who you'll hear from, around educating patients with liver disease, educating our other specialists, and educating family physicians around liver disease in general. And then lastly, hiring and training an RN in my own clinic in order to be able to do FibroScans, a special technology to look at liver fibrosis, and as well provide clinical support, patient phone calls, because as you can imagine, there's a tremendous amount of blood work and imaging generated by patients with chronic liver disease. So have I had any successes? Thankfully, yes. The top left graph there shows that at the very beginning of my project, patients that I saw in clinic who already had cirrhosis of the liver or advanced end-stage liver disease, 60% were getting regular every 6 months screening ultrasounds to look for liver cancer, but the most recent evaluation I did in my clinic showed that now 86% of patients that I have seen in clinic have had their appropriate ultrasound workup, so I felt that that was a real success. In conjunction with our partners for the Northern Isolation Travel Allowance Program, I have verbal approval or preliminary approval that from 4 visits a year to the Cranbrook Hospital, which is my closest larger city, that I'll be able to run 10 clinics per year in order to care for those with chronic liver disease. These are often patients that have little social support, little financial support, and are sometimes too ill or elderly to travel. So now I can go to them supported. I did hire this RN, and she's actually been able to reduce the time to consultation by increasing my capacity and how many people I can see per day that are new patient visits without compromising patient care. And the checklists as well have improved the speed of the consultation itself, so that I'm not scrolling between 3 sets of computer screens, making sure, saying, oh, did they get the AMA or the ASMA or the ANA? And it's really helped my flow and my thinking when I see the patient in the process. So the future that I see is continuing approval of this referral pathway. I'd like to create a locally relevant non-alcohol fatty liver disease pathway. This is the fastest rising cause of all liver disease. And the programs that are out there so far are not really relevant to some of the people and the location that I service. I would love to work closer with my radiology department out of the East Kootenay Regional Hospital to secure non-invasive testing for fibrosis using their existing ultrasound equipment. So this is a small cost that would access, so that primary care providers could access this advanced technology and help determine who are sicker and who's not sick. And lastly, I also hope to work within IH or with my IH partners towards a goal of a supported role of an RN or a nurse practitioner to help look after patients with chronic liver disease in the East Kootenays, similar to how we have other chronic illness programs. Thank you.